Hello, everyone, and welcome to the Hot Zone. I'm your host, Jason Robinson, and in the Hot Zone this week, we've got Senior Emergency Room Doctor at St. Barnabas Hospital in the Bronx, Dr. Ernest Patti. We're going to talk to him today about the latest that's going on in the coronavirus pandemic and what it's like working on the front lines. All that and more, so stay tuned because you're in the Hot Zone. Welcome to the Hot Zone. We've got guest Dr. Ernest Patti from St. Barnabas Hospital in the Bronx joining us today. And first of all, welcome to the Hot Zone. Thank you so much for joining us, Dr. Patti.
Thank you for having me. I really appreciate it.
Yeah, I want to start by saying thank you for all that you do. And I want to first ask you, how are you doing? And how's your family doing? Are you safe? Are you healthy? And I ask that because people sometimes forget that doctors are humans too. So I want to see how you guys are doing.
I really appreciate that. First, let me just say that I appreciate you thanking me, but remember, I'm a little piece of a big team. I work with a wonderful team at St. Barnabas, from the folks who keep the hospital running and clean all the way up to the nurses, doctors, and all the techs that help us. But me personally, I've been okay. I pretty much, since the early part of March, I decided to quarantine myself away from my family because I knew that I'd be exposed to patients on a regular basis who had COVID-19, and I did not want to bring this home to any of my family members. So I pretty much have been staying in what I call the quarantine apartment, and I haven't seen them. I do drive-bys once in a while, and we talk to each other I stand on the street and they're inside waving, but talking through the door. But it's just my way of ensuring that I don't bring anything home. It sort of affects you a little bit when you're alone by yourself all the time. Yeah. But I know that this is a necessary means to an end.
And that is so tough on you doctors and nurses on the front lines to make that decision to separate yourselves from your family. Obviously, you're doing it for a great need. But that's got to be a tough decision for you to make, right?
It definitely is. This is an important time for families in general. You're getting to the end of the school year. One of my daughters is graduating from university with honors over at the Newhouse School of Communications at Syracuse, my daughter Victoria. And, this week we would have been celebrating her graduation coming up. My son, Ernest, is graduating from Fordham Prep from high school. He's going to be going on to college at the University of Miami. No prom, no graduation for him. This would have been a really important time. And now sequestering myself because of this illness just makes you stop and think about things. And fortunately, I'm very happy and proud of both of them, as well as my older daughter, Alexandria, who's waiting to get into medical school. But it's just tough not being around everybody on a daily basis,
Right, but you're keeping them safe, and that's the number one priority. So
exactly, that's what we're doing.
How is your day-to-day during this coronavirus pandemic?
Well, I can tell you, starting early in March, probably actually the second week of March, that's when we started to notice that we were starting to get these patients coming in, and the volume all of a sudden just increased like dramatically, where people were coming in really sick with suspected COVID infection, and the ability of us to get these folks in and on oxygen, and a lot of them required being put on ventilators right away. Just the overwhelming volume of them was crushing. And fortunately, we were able to respond appropriately. But there was a time a couple weeks ago where I would show up for work and we would have 19, 20 ventilated patients in the emergency department itself, which that number is bigger than a lot of hospitals' ICUs, where you have them up in the ICU. We had them down in the emergency department, and we were monitoring them, running a mini ICU down in the ED. That was extremely stressful on a number of levels. Number one, it was very, very noisy because of all the monitors and IV infusions and all types of equipment that we have that were keeping these folks alive on at the same time. Number two, we had to be in full PPE, or personal protective equipment, which was also very taxing, both physically and mentally. First thing is it keeps you obviously warmer than usual. It's very restrictive. It's hard to hear your colleagues as well as to speak to them where they can hear you, because you have masks on, respirators, you have protective shields. A lot of times you're wearing a hood. And number three, both for the patients, they can't see you either.
Yeah.
And it's tough for them to appreciate you, whether you're smiling, whether you're frowning. You know, people need that human contact.
Right.
So these things made it extremely challenging. I found myself coming home at the end of the shifts being not only physically, but also mentally, exhausted. And then you had to remember to be vigilant, and at the door, before you came in, take all your clothes off, come in, wash your hands and face, put everything in a separate bag, don't pretty much touch anything, jump in the shower, and sort of decontaminate.
You guys are at risk every day. You're on the front line. So do you guys have enough PPE at the hospital, and do you guys feel safe with the PPE?
I personally feel safe because I pay attention to putting it on properly, taking it off properly, and really am vigilant with wearing it, as is most of my colleagues. They're all very, on top of it. But I have to tell you, it causes you to pause for a moment when you're doing a procedure, say like when I'm intubating a patient, which happens, regularly we're doing this, and you're down there in that person's airway, very close to their oral secretions, and they're breathing right on you, actually. You're passing a tube. I'm saying to myself, this mask better be doing its job. This respirator better be working. The fluid, the shield better be protecting me from the aerosolization. And it causes you to pause for a minute, Jason, and really think about it, and say, whoa, I hope it works. I hope it does its job.
Yeah.
A number of my colleagues have come down with the infection. Fortunately, most of them have recovered. Unfortunately, up to this point, we lost 5 beloved members of the St. Barnabas Hospital family, and it's just tragic that we had to lose anybody. And we lost 5, and they, contracted the illness. How they contracted it, I'm not sure, but these causes you to stop and think about your personal protection, your personal safety, and your ability to stay healthy so you can keep delivering care.
And sorry for your loss, doctor. I know you guys at the hospital have been doing an amazing job. So sorry for the loss that you guys have experienced. It's really tough out there, but you're doing a great job, and you've saved a lot of lives as well. So that's great as well.
It's great you mentioned that. The other day, we discharged our 500th successfully treated COVID patient. Yeah, we not yesterday, day before. We discharged him. He was able to walk out of the hospital, and it was a real big event for everybody. It was a good morale booster, as well as it caused the community to stop and take a moment to say, wow, they really are doing a great job up there.
A lot of times we see the doom and the gloom stories, and obviously a lot of the negative stories, which is true, and it's important to cover, but there are a lot of positives coming from this, and we are improving. Although it's little by little, but each day we are improving a little bit. So it's really good to hear a lot of the positive stories as well. So thank you for bringing that up. But what are some of the new symptoms that you might be seeing that we may not know about in the patients at St. Barnabas?
We actually saw pretty much a constellation of symptoms. Okay. Some of them included things like loss of sense of taste and smell. Other folks came in with just literally gastrointestinal signs and symptoms, sort of like a stomach flu or stomach bug, those kinds of things. And then others came in with just a headache. Like I've had some headaches and I don't really feel good. Maybe some body aches, almost like the beginnings of a influenza and infection. So we have had the gamut, and obviously others come in with a cough, short of breath, can't oxygenate. Those are the serious ones. Interestingly, we've seen a couple cases where folks have these lesions or rashes on their body, and some folks have it on their toes. I don't know if you've heard of COVID toes.
Wow, no, I did not hear about that. Wow, okay.
There's a term that they're using on the internet called COVID toes. And some folks, usually it's in younger kids and teens, even some folks in their 20s and 30s, who may have symptoms of the disease, may not. But they get sort of a discoloration. Some folks it's like a discoloration. Some it's a redness. Others it looks like a pale color discoloration to their toes. They may even get a little inflamed, and they may hurt, they may not hurt. And those folks, they are assumed to maybe have been infected with COVID or maybe in contact with it. Some of these patients come up positive when you test them, others don't. So it's been theorized to be like an inflammatory type response that exhibits itself by these lesions in the feet.
Okay.
Some other folks get them on the torso. Some people have had like these red raised lesions on their torso. Some of them similar to hives, others
Okay.
not. So this is something that we have seen, not every day, but we
Right.
have seen cases of it.
Gotcha. Um, I'm curious about, I've heard stories and reports that men are actually more susceptible to catching and dying of the coronavirus than women. Why is that the case?
Well, from remember, I'm not an expert in immunology or virology, but from what I've read, there seems to be a connection with the immune system response,
Okay.
or the differences in the immune system response, both in men and women.
Okay.
And some folks have theorized that it has to do with the fact that women get a double X chromosome and men get a XY chromosome.
Right. Okay.
And they're theorizing in certain response cases that women's immune systems have a more robust response to viral infections than men's immune systems.
Right.
Uh, and they have noticed that there is definitely a predominance of infection, or I should say, serious infection in men. Women
Right.
seem to be getting the infection in higher numbers in certain areas.
Oh, really?
Now,
Okay.
now remember, not every area reports the information the same way.
Right.
But as far as deaths go, and at least as far as we go in New York, it definitely seems to be that men are predominantly dying from this disease in a greater number than women are.
Gotcha.
And they theorize it may be due to the immune response.
What about the African American community? I'm hearing that they are more at risk than others, and I'm curious as to why that might be the case.
Yeah, there's also been theories that have been talked about on that regarding that. And working where I work in the Bronx,
Right.
I am definitely seeing a high concentration of African American folks coming in sick with COVID.
Mm-hmm.
But I have to tell you, because we're a safety net hospital, we're getting very sick patients, and it's not like I'm not seeing other nationalities represented as well. I am
Mm-hmm.
definitely, because of the area we work in.
Okay.
And it could be too because of a lack of accessibility to healthcare.
Mm-hmm.
Especially in African American folks. Could also be because they tend to work in areas or in occupations that have higher exposure to the public.
Okay.
They might work for the MTA, they
Right.
might work in food service, they
Right.
might work in home health care where they're always around sick people or potentially sick people. It may also be linked, at least from what I read, to the fact that there is a high incidence of hypertension and diabetes in African Americans. And those comorbidities could increase, I imagine, at least that's what we're seeing from our spot anecdotally, could increase the infection numbers, but also in causing these folks to be sicker than other folks because of these comorbidities.
What can I say? It's the end of the shift. Saturday, April 4th. Just a horrendous shift. We have right now 21 ventilators running here in this emergency department. In the hospital, we have roughly 90 ventilators running, and we only have a few left to spare. Medical notification. We've been getting them back to back. Most of them all respiratory related. People who can't breathe. People who are drowning in their own secretions. The humanity is just horrible. Some people didn't make it today. And I guess that's just, we did our best. That's all I can say. It's not been a good day.
What's your thoughts on ventilators and its effectiveness?
When you look at the whole topic of artificial respiration or putting a person on a ventilator
Mm-hmm.
to help take over the work of breathing, what happens in my arena when I have a patient whose oxygenation is slowly decreasing, and that's because of inflammation and or infection going on in their lungs, preventing the lung tissue from exchanging oxygen for carbon dioxide and allowing you to breathe normally. When that oxygen level drops low, we don't have many options. What we do is we give people oxygen that they can inhale through their nose and mouth in higher concentrations. But when we get to the max concentration and their oxygenation is still dropping or dipping lower, the only alternative we have then is to apply, to give them assisted respiration by using pressure. We basically place a tube down their trachea, and we blow air in there, and we manually inflate and deflate their lungs with 100% oxygen to try to push that oxygen into the bloodstream so it can get delivered to the tissues and they can survive. And we do that a number of different ways. If the patient's conscious, we can put a mask on them, similar to like a CPAP machine that a person would wear when they go to sleep, at night, to help them with sleep apnea.
Right.
But you have to be conscious and awake for that. You can't be like unconscious and we be doing that, because you need to be able to swallow your saliva and not, regurgitate and then vomit. It's a balancing game. We'll increase the pressure, we'll lower it. We'll increase the rate, we'll lower the volume of air we put in with each breath. We call that barotrauma, because we sometimes cause pneumothoraces or just damage in general to the lung tissue, which prevents it from oxygenating. One of the exciting things that we're looking at, actually at certain centers, and St. Barnabas is included in this, is by using something called hyperbaric oxygen therapy.
Okay.
Hyperbaric oxygen therapy is where you put a person in a chamber that we call a hyperbaric chamber. And this was originally utilized for folks who had the bends when you'd go deep sea diving.
Okay.
Come out and you get the bends. They'd have to put you in a pressure chamber, increase the atmospheres of oxygen that they deliver to you, and let you decompress.
Right.
Well, over the years, folks realized that type of therapy can help heal wounds because it pushes oxygen into the tissues without using increased pressure. That's the beauty of it.
That's great.
You increase the oxygen concentration, but you also increase the atmospheric pressure of the chamber you're in, which will push more oxygen into the cells without actually forcing it into your lungs. There's downsides to that therapy, though, and you have to be conscious and awake, and you have to be able to tolerate being in it's like a glass chamber that you'd be in, and you can talk to folks from the outside, but they have to be in there. The problem is if you put people in there who don't have the infection to monitor them, they are at increased risk of getting it because they're in a closed chamber with folks who have it. So there's a lot of downside. Well, I shouldn't say a lot. There's some downside, but if the upside is to keeping people off a ventilator so that they can oxygenate properly and giving their lungs a chance to heal, that's going to be one of the positives.
The FDA approved a new drug that they want to use for the coronavirus. I believe it's called remdesivir.
Yes.
Right? Now, tell us about that. I guess it's potentially, it could help. What's your thoughts on this new decision by the FDA?
I'm excited about anything that's going to help us with this. Obviously, we're looking for more tools in our toolbox, or more guns in our ammo box, whatever analogy you want to use. It's an antiviral medication. And that's good because we're sort of limited with the numbers of antiviral medications that we have at our disposal, especially ones that have been tried and true against coronavirus. Dr. Fauci had mentioned that it seems to be very promising. And obviously, this is a man who knows his medicine and his virology. So I'm hopeful that if he sees a benefit to it and we start rolling it out at different centers and we start to see progress with it, that it might be a good medication. I'm not an expert in that field, so I can't really comment yet until I see more studies. But anything that will help us battle this virus, I think would definitely be useful to look at and to start utilizing if the safety of it is okay.
What else can we do as a people to just make, at least help ourselves not catch the coronavirus or to prevent it? What tips can you give us to do to help prevent it from happening in the first place?
One of the things that everybody has to remember, especially in a modern society like we live in, is we have to pay more attention to common sense, and some of that has slowly decreased over time. I'll be honest with you. The last time you went into a men's room, I'm sure at some point over time you might have noticed someone who comes in, uses the facilities, and then walks out and never washes their hands.
Exactly.
I mean, my daughters used to be so observant of that when they were younger, and I'd have them in the men's room with me, and because they're young, strong women that we wanted to raise that way, they would vocalize that that person didn't wash his hands.
Right.
And sometimes these guys would get guilted into coming back into the
and washing their hands. Right.
No, you're right. But why does it have to get to that point? You know, this was
Right.
20 years ago. We ride subways, we go on buses, we
Yeah.
touch handrails, we open doorknobs. We always have to remember, you know, to before you eat dinner, before you you know, do anything particularly, you should wash your hands, obviously, and keep yourself as clean as possible. I have been preaching for years, Jason, to my medical students and residents, and now I finally got some satisfaction because they told me I had been right for many years. But I
Good.
preach to them something I call the Patti method.
Okay.
You know, after my last name.
Okay. What's the Patti method?
Patti stands for protection, all the time, imperative or important or indicated, whatever you like for the letter I, Jason. I don't care. It's up to you. So the Patti method. Some of the other things I think about that really would help is proper taking care of yourself, proper habits, right? Mm-hmm. Proper nutrition, very important. You need exercise. You need proper sleep, right? Imagine during these quarantine periods, everybody talks about how they binged Netflix or binged, watch this. That means folks are staying up late and they're probably sleeping in late and maybe falling asleep with the TV on and not getting enough good sleep. Plus, you need to remember, if you're a spiritual person, and even if you're not, you need to do some mindfulness, or you need to reconnect with your spirituality. You need to meditate at times, maybe a little yoga, whatever you find that's going to help you release that stress and lower your anxiety level is definitely going to boost your immune system, because your body needs rest, both physical rest and also spiritual and mental rest.
Dr. Lorna Breen, she committed suicide. And it was such a sad story. She actually had COVID-19. She recovered and she went back to work. And I mean, she died doing what she loved. But what kind of impact has this virus had on doctors and nurses on the front lines on an emotional level dealing with this pandemic? It has got to have been so devastating for you guys.
That was a terrible and tragic loss for us. I mean, you know, anytime someone in our community and our brother and sisterhood gets afflicted like that, it's really a horrible, you know, wake up call to all of us that, you know, the stress and I'll use the term PTSD, right? Post-traumatic stress disorder. You know, that can rear its ugly head either early on or even later on. You know, you never really know what happens. And I can only speak from my personal experiences. You know, there were nights when I was driving home where I basically was talking to myself and to, you know, our creator, whoever, you know, the whole way home, because you're like, how does this happen? How are we supposed to deal with this? I mean, I mentioned to some of my colleagues that, you know, being there with some people when they had their last breaths was a very profound and emotional experience for us, when their relatives were on, you know, the cell phone and we were trying to get them to communicate with them, or we were using tablets because we couldn't have family in the hot zone. And it was horrible for a lot of us, because we wanted the families to know that we really do care about their relatives, and that's why we're doing what we do.
Right.
But it's hard when there's, you know, we didn't have them present. They couldn't really see what we were doing. You know, a lot of times during resuscitations and under normal circumstances, we'll have a family member present or in the background just to see the effort that goes into, you know, the care of their loved one, so that they can see all the folks that are responding and working, trying to save another person's life. We didn't have that ability during this pandemic because everybody was permitted, you know, were forbidden from coming into the emergency department. So just a few folks that we could contact via cell phone or iPad and actually bring them to the bedside, they had some idea. But then still, you're wearing all this PPE and you can't even have a meaningful conversation.
And that's why at that point, that's when you need your family and you need your friends to really talk with you, speak to you. And it's very important in what you guys are doing at St. Barnabas, and I'm sure a lot of the other hospitals, by providing support for the doctors and nurses on an emotional level, speaking with them, therapy, any kind of support, I think is really important, because we need you guys to stay safe more than ever, both physically and emotionally. That's super important, because we need you guys, and you're doing a tremendous job. And we seriously can't thank you enough for what you do, but we just want to make sure that you guys are as safe as possible because you are protecting us, and we thank you.
Oh, thank you. Like I mentioned earlier, it's a huge team. I mean, from the first responders all the way down to everybody at the hospitals and the facility, the medical facilities. I mean, it's tremendous effort that runs citywide. You know, we lost a first responder as well, I think, committed suicide recently, besides that doctor.
Mm-hmm.
You know, and these are the folks that, you know, they go into the fire, man. They go into the house. They go into the environments, you know, without ever thinking, you know.
Where is the first place that you want to go on vacation or anywhere? What do you want to do as soon as this is over?
What I really want to do is I want to properly get together with my my children and my family.
Right.
And honestly, I don't care where it is. It could be at home.
Mm-hmm.
Would it be nice if it was at the beach somewhere where you can sit, put your feet in the sand and salt water and maybe forget a little bit about the city? That would be nice if it could be there. Right. But I'd really like to get together with my kids and my family and all the extended family and have a proper, you know, meal and a proper ceremony to celebrate my kids' graduation.
Yeah, all right. It's family time. You and your wife are truly blessed with a beautiful family. I got to thank you again for all that you do on the front lines for all of us. And just keep doing it. Keep strong. Keep positive. And keep just being you, Dr. Patti. Seriously, we love you. And thank you again for all that you do. Thanks,
Jason. I love you too. And I appreciate you giving me the opportunity to sit and have a chat with you in the hot zone.
There you go.
I love it. Thank you.
All right. Take care, buddy.
Please stay healthy.
We will. And talk soon.
And you and your family. Yes. Thank you.